Hello friends, here is a video on a clinical case-based discussion. So let's see what the case is. A 2-year-old boy was brought to the hospital in a profound hypotonic state. There was a flaccid paralysis of the muscles throughout the body and the boy was almost in a semi-unconscious state. There is drooling of saliva and drooping of the eyelids. There is difficulty in breathing and swallowing. Muscles are paralyzed, almost paralyzed, and therefore all these manifestations. The boy is fond of eating home-canned honey. Well, this is a big hint towards diagnosis. So the question is, what is the most likely diagnosis? And explain the physiologic basis of this condition. So this could be a first prof question for 5 marks or maybe even 10 marks. And of course, it will be useful for your PG entrance preparation. So let's go further, diagnose the condition and discuss the physiology behind it. Have you yet subscribed to the channel? No? Go ahead and do it now and hit the bell icon. Okay, the condition is botulism. Now this condition is caused by Clostridium botulinum, or rather the toxin of the Clostridium botulinum. Well, and the hint was in that home canned food. The boy is fond of eating home canned food, and that was the hint, because this toxin, the Clostridium botulinum or its toxin, gains entry in the body via a wound, either an infected wound or through the digestive tract. How through the digestive tract? Via the contaminated food or home canned food. Yes, this is a very common route in children of his age group, 6 months to 2 years, 3 years, 4 years. So this is very common in the children. And why it's so? It's because in the home canned food there is lack of oxygen in those containers. There is no oxygen, and here is an anaerobe, so therefore it can easily grow in those home canned containers, and therefore resulting in the condition called as botulism. So solve the first question. Now the second question is physiologic basis, which is more important for the first prof level. So let's see. We need to understand the synaptic transmission or the neuromuscular transmission. Neuromuscular junction is also a synapse. So what's common? Look, in the synaptic transmission or neuromuscular transmission, here is a here is a presynaptic terminal, here is the muscle. Let's take the muscle. You know, there are neurotransmitter vesicles in the terminal, and in this case it's the acetylcholine. Now these vesicles, they will fuse with the presynaptic membrane, and only then the acetylcholine will be released into the synaptic cleft, and it will reach the muscle membrane. Then it will excite the muscle and muscle will contract. Now for this fusion of vesicle with the presynaptic membrane, there are certain proteins which are necessary, and those proteins are called as snare proteins. I repeat once again, there are proteins which are specifically involved in fusion of the neurotransmitter vesicle, the acetylcholine vesicle, with the presynaptic membrane. Once that fusion occurs, only then the acetylcholine will be released by exocytosis. Now there are two types of proteins. Let's add here, there are two types of proteins. In the vesicle membrane, in the membrane of the vesicle, there are V snare proteins. V stands for vesicle. Another name for them is VAMP. If you know the what's a VAMP, well, here it is vesicle associated membrane protein. So in the vesicle or membrane of the vesicle, there are these proteins, V snare proteins, for example synaptobrevin, and this presynaptic membrane is the target membrane, because vesicle is going to fuse with that membrane, so it's the target membrane. In the target membrane, there are T snare proteins. T stands for the target. For instance, syntaxin or SNAP25. Look, all these have certain full forms. For example, synaptosome associated protein is SNAP, but you can remember these short forms as well. And the interaction between V snare and T snare proteins will cause fusion of the vesicles and exocytosis of acetylcholine, which means if the snare proteins are not available, then acetylcholine release will not happen, and if the acetylcholine release does not happen, then the muscle cannot contract, and that precisely is what happens in botulinum. So if there is a wound, for example, if there is some injury, some wound, and the Clostridium botulinum or its toxin gains entry through this wound, what will happen further is that it gains access through the presynaptic terminal. There are end feet or release sites where it finds the receptors, and via those receptors or those areas, the toxin will enter the presynaptic terminal. Once it enters the presynaptic terminal, it will act on the V snare proteins. Many of the varieties of the toxins, they act on the V snare protein, and act means they cleave those proteins. They cleave the snare proteins. So that means the snare proteins will not be available. And if snare protein is not available, then acetylcholine will not be released and the muscle cannot contract. There is muscle paralysis, and that is what happens in this particular condition, the botulism. So that's the physiologic basis. Let's see what more we can see here. Additionally, you can also write there are three types of botulinum toxins, A, B and E. These three are toxic to the humans. A and E toxins, they act on the SNAP25, which is the T snare protein. And toxin B will act on the synaptobravin. It will cleave the synaptobravin, and therefore it will stop the release of acetylcholine. This is how it will interfere with the neuromuscular transmission throughout the body, and that will result in the flaccid paralysis of the muscles. And common manifestations are ptosis, drooling of the eyelids or drooping of the eyelids, drooping, and then diplopia, double vision, because extraocular muscles are paralyzed and therefore there cannot be conjugate movements of the eyes, and it results in double vision. Dysarthria, difficulty in speaking, difficulty in speech, and dysphagia, difficulty in swallowing. So all these manifestations were seen in this boy, and therefore the diagnosis was botulism. There are other uses of this toxin. For example, Botox injection uses botulinum toxin, but we will discuss that in some other video. For this particular case, that's all. But have you not subscribed to the channel yet? Go ahead and do it now.